I'll be presenting my Executive Integrated Medium Plan for Ascension Sacred Heart here in Pensacola. The purpose of this plan is to help strengthen patient relationships, increase the awareness of the healthcare services available within the Panhandle, and ultimately deepen the trust that the community has in Ascension Sacred Heart. Because healthcare decisions are very personal, the strategy focuses on creating consistent communication across multiple channels and making sure patients feel connected to the organization throughout their entire healthcare journey. So, why is integrated marketing communication important for a healthcare organization? Well, healthcare decisions aren't usually impulse decisions. Rather, patients are looking for trust, reputation, quality, and convenience. Here at Ascension Sacred Heart, they already have a very strong foundation. The organization has served the Panhandle, specifically Northwest Florida, for more than 100 years and operates a 547-bed campus that includes a Level 1 trauma center and Struder Family Children's Hospital. It also provides a very broad range of services from emergency and primary care to pediatrics, women's surgical specialty, and the rehabilitation services, which is where I work at currently. The challenge is making sure people actually know about these services and understand where they can access them. Looking at situation analysis, one of Ascension Sacred Heart's biggest strengths is its reputation as a regional destination for specialized care. It has Northwest Florida's only children's hospital, along with a long history and a strong mission-driven identity. There are also several opportunities. The organization has an opportunity to continue expanding its community health strategy, especially through partnerships with federal qualified health centers and underserved populations. Digital engagement is another major opportunity because more patients are using the internet to research healthcare providers and making those healthcare decisions. At the same time, that's also a challenge. Patients can easily compare healthcare providers online, so Ascension Sacred Heart needs a clear and consistent message across every communication channel. The marketing strategy is built around 5 main objectives. First is increasing awareness. We want Northwest Florida residents to understand what services are available and where they can receive them. Second is to strengthen the trust. Patients' testimonials, physician stories, and community involvement can make the organization feel more personal and relatable. Third is driving digital engagement. This includes increasing traffic, social media engagement, online appointment activity, and patient portal care or use. Fourth is improving utilization. The goal is to move people beyond simply seeing an advertisement and actually taking action, whether it's with scheduling appointments, finding a physician, or attending a healthcare event. And finally, community access is one of the big ones. The strategy should also increase awareness of Ascension Sacred Heart's efforts to improve healthcare access for underserved populations. The campaign focuses on several important audiences. The first is families and parents, particularly those looking for pediatric emergency and specialty care. The second is women, including women seeking maternity, high risk pregnancy, or neonatal and regular women's health services. The third audience is older adults and caregivers who may be looking for coordinated care, specialist rehab, or cardiovascular services. And finally, there are community partners such as physicians, employees, schools, churches, and nonprofits. These communities can influence healthcare decisions and help distribute information throughout the community. The overall positioning statement is care that meets you where you are. The idea behind this is that Ascension Sacred Heart should be positioned as a trusted healthcare partner that provides compassionate and advanced care close to home. Traditional media still has an important role in this strategy, but it needs to work together with digital media. Television focuses on emotional storytelling and real patient experiences rather than just simply listing services. Radio could provide frequent reminders about the seasonal health topics, screenings, vaccines, and upcoming events. Outdoor advertising would use short, memorable messages for people just commuting around the area and just reading as they're walking around. Print advertising would be more selective and targeted towards parenting, senior, and community publications. And the important part is that these traditional channels shouldn't operate independently. They should direct people towards digital resources where they can learn more and take more action by doing their research. Direct marketing would then personalize communication through segmented emails, appointment reminders, wellness information, event invitations, and post visit follow ups. The goal is for direct marketing to feel more like relationship management than advertising. Digital media is really all of these channels when all these channels come together. The website should serve as a central hub. Every major channel should ultimately direct patients back to the website where they can find physicians, locations, services, and appointment information. Search advertising would target people who are already actively looking for healthcare, such as someone searching for a pediatric hospital in Pensacola or a cardiologist nearby. Social media would also be customized by platform. So Facebook would focus more on a community news and events. Instagram could emphasize visual storytelling, and YouTube could feature physician interviews and educational content. Short videos could cover the topics like heart health, maternity, and injury prevention. And another important piece is employee storytelling. This shows the people behind Ascension Sacred Heart can make the organization feel more personal and help build trust. So just getting a glimpse of, your rehab team, or just a simple interview of, what happens in a day, but keeping it, a little bit more relatable. Sales promotion in healthcare isn't necessarily about discounts. Instead, it can involve free or low-cost health events, screenings, seminars, and parenting classes. These events can give people an opportunity to interact with the organization before they necessarily need medical care. One example is Medical Mission at Home, which took place May 2026 and served nearly 200 community members. Um, sorry, 200 community members through medical, dental, vision, and women's health services. Public relations is also a major part of building credibility. Patient stories, physician experts, media relations, and crisis communication preparedness can all help contribute to the organization's reputation. And finally, personal selling is especially important in healthcare. Every interaction a patient has with a nurse, physician, or staff member becomes part of the communication experience. That means that marketing and clinical teams need to work together because the patient experience itself is a form of communication. Okay, so this slide really shows how all these pieces of the strategy connects. The goal isn't for the patient to see one advertisement and then have the relationship and that relationship just end. Instead, the communication should continue. For example, a patient might see a television advertisement, visit the website, schedule an appointment, receive a follow up communication through the CRM system, and continue interaction with Ascension Sacred Heart through social media or even patient portals. That can create continuous communication cycles instead of single touch point. The CRM system can connect with these interactions and help um, can have a positive experience and receive appropriate follow-up communication, helping maintain the relationship between a single appointment. Community partners such as schools, churches, employers, and nonprofits can also extend the reach of the campaign by sharing health information and promoting the events. Finally, the implementation strategy divides the budget across several major channels. The large allocation is digital and social media at 30%. TV and video receive 25%, followed by the radio at 15%. Outdoor advertising receives 10%. PR and events receive 10, and the CRM and creative receive the remaining 10%. Okay, the campaign would move through 4 phases, which is developing the messaging and creating the creative assets, launching advertising, engaging with the community, and then evaluating the results. Success would be measured through communication metrics such as reach, impressions, click-through rates, video views, email open rates, and social engagement, but it's also important to measure actual business outcomes. That includes appointments, appointment requests, conversions, patient retention, and follow-up care utilization. A monthly dashboard, A monthly dashboard and quarterly review would allow Ascension Sacred Heart to determine which campaigns should continue, which need to be adjusted, and which should be expanded. I do apologize for my child crying. Overall, the goal of the integrated media plan is to make every communication channel work together to create a stronger, more consistent relationship between Ascension Sacred Heart and Northwest Florida community. Thank you so very much.